personally, I have not used Aflibercept, which actually our whole practice in Colorado, I don't think any of us have used it. Partly because it's very hard to position it. We're not biased against it, but because it wasn't compared to bevacizumab, and it actually has way more side effects than bevacizumab. I mean, it's not like it's intolerable, and the chemotherapy itself has side effects, but putting it all together, the question is, what is going to make it a practice-changing agent? And so that's been really difficult. And so I think that it's not clear at this point whether or not down the road you could say, well, right now there's evidence that bevacizumab works beyond progression. So is there going to be a role for putting Aflibercept in that kind of scenario? Because if it does work consistently after bevacizumab, that might be a place to use it. But what we don't know is also the reverse. If someone decides to use Aflibercept first, does bevacizumab work? You know, and there's lots of data of single-agent anti-angiogenics in renal cell carcinoma showing that you can sort of play around with the sequencing and how you use them. In colon, we just really haven't looked at that yet, and I think there's also the chemotherapy effects, because both of those drugs are largely used with chemotherapy to sort of get a better effect.